Hello, I'm Dean Whiting from Pathology Technology Australia. We're the peak body that represents the developers, manufacturers and suppliers of the pathology technology so vital for human health testing in large pathology laboratories, hospitals, in community care testing and even for home testing. Our companies employ the best scientists, engineers and medical specialists available to ensure that all of our products are manufactured and designed to meet human healthcare needs. As well as that, our companies conform with the rigorous, the highest possible standards in quality, in processes and in manufacturing. Products are tested in real-time cases in the field to make sure that they work correctly. And indeed, our companies also retain technical specialists and scientists to go into the field to make sure that the products are working the way they should. Such attention to detail has never been more critical than it is in times of the healthcare challenges that we have with COVID-19. Indeed, we have 20 member companies who provide critical components of testing for COVID-19. And indeed, all of our members are critically involved in the testing across the board for the 50% of Australians who have a chronic illness and the 70% of medical needs where pathology plays a critical role in diagnosing or managing healthcare issues. But the 20 companies I referred to actually provide almost 100% of the technology required to extract viral RNA and DNA for the testing, and they also provide a huge percentage of the actual testing and detection systems. So they play a vital role in how we manage COVID-19 detection. They continue to ramp up their production. And the striking feature that we have in traditional companies who have this capability is that they can leverage their existing processes, their existing manufacturing technology, their existing quality control processes and their existing supply chains to make sure that as they ramp up, the products that come out are of the highest quality possible. And they're also engaged in ongoing innovation around what sample types can be used, ongoing innovation to ensure that the detection systems are detecting changes in the virus. Indeed, we have a number of members who are Australian-based innovators in this area, providing some of the greatest innovations, some of the best ideas into solving these problems. We also have members who provide the antibody assays, and you may have heard me talking in the past about the importance of antibody, so-called serology assays, for tracking immunity in the population. So our members also provide high volume, high quality assays for tracking immunity. PTA itself, Pathology Technology Australia, also engages at very high levels within government departments. So we play a very active and critical role in consulting with the TGA, in providing advice and guidance. And this maximises the safety and efficacy of the devices that are being brought into Australia and approved by TGA. We also work very closely with the Biosecurity Division in the Department of Agriculture to maximise the safety, to maximise the risk, or to minimise the risk of biosecurity problems in Australia, protecting our vital agricultural industry and protecting our environment. We work closely with the Department of Health to make sure they understand what new technologies are available and how they fit into our needs. This all highlights the need for a fit and healthy pathology technology industry in Australia. If we're going to be able to mobilise to meet these stresses and challenges, we need to make sure that our industry is healthy. You can also make sure that you're getting the highest quality device, the best quality device for the needs, for your testing needs, by always asking, is my supplier a member of Pathology Technology Australia? I'm Dean Whiting from Pathology Technology Australia.